One way to innovate in healthcare is through targeted, bite-sized training. Many will agree that the future of medicine will involve using technology and data to drive several things. First, to deliver better care. New payer models are driving our health system towards value instead of volume-based payments, and technology leveraging data and data warehouses is presenting information to physicians in new ways to help us better make decisions while caring for patients. Technology will also help us select better care, and as a physician, I include myself in this category as well, because the fact is, my family and I have all been patients and have to make these same decisions. As you see here in this consumer report on hospitals in a region, which includes scores on safety, infection rates, and more, data will certainly influence how patients select care. There are a ton of quality websites available for patients to find this type of information, and hospitals who are leading the pack are posting their scores directly on their website for the public to view. Here's a snapshot from the UCLA website. Notice the data driving most of these reports is old, 2011 in this instance, which is why hospitals need to change today to be ahead of the curve tomorrow, when more of their patients will be influenced by this data. Obviously, I'm not the only one talking about this. There are tons of different solutions. That's not the innovative part. The innovative part is training, and not just any training, targeted training. And not just any targeted training either, but targeted training that can change a physician's behavior, enhance their performance, is cost effective, and won't waste their time. Let's quickly examine two common scenarios that could benefit from targeted physician training, either clinical documentation challenges that might lead to the selection of the wrong DRG, shortchanging the hospital on reimbursement, and misrepresenting how sick this patient really is. I'm going to add the EHR to this theme because the way a physician enters patient data into their EHR can also affect the accuracy of the data that goes out from the EHR. The second common theme is related to overutilization, where BI tools can help you identify very specific issues, such as ordering too many CT scans and chest x-rays, discovering new and abundant cost savings opportunities. So, now that you have identified what to fix and know it will have a major impact, how do you do it? It obviously involves training, and not just any training. Again, here goes the innovative part. Targeted, bite-sized training for physicians. We already know physicians have no time, and they're frustrated as well. The targeted aspect to training is extremely important because you will lose your audience's attention if the training is not relevant. And the attention is one of the most important factors to learning. And once it's gone, it's very difficult to regain. What a physician does is very different from specialty to specialty. So is the technology they use, how they use it, the context of which they use it, and those opportunities for improvement. As a physician myself, I don't want my time wasted with generic training. I'd much rather be spending the little free time that I have with my family instead of wasting my time here. In fact, at a recent implementation of CPOE, we found that 88% of physicians would prefer to learn online than in a classroom when given the option and when the online training was targeted. The second component to this training innovation, in addition to the targeting, and especially in relation to e-learning, is using bite-sized training modules that are 3 to 5 minutes long, instead of 15 minutes, 30 minutes, or sometimes even an hour long. Portion control not only helps keep the fat off the thighs, it helps keep the fat off your training as well. And it is proven to be more effective and save costs. Here's one of my favorite quotes. Prevailing wisdom dictates the longer we spend in training, the better. Not only is this false, it's irrational. Just as travelers prefer reaching their destination faster, learning quality should be judged by the outcome, not length. By using a bite-sized approach where training is broken up into 3 to 5 minute long computer-based training modules as part of an overall library and customized to your specific workflows and technology, you can then design curriculums that pull in what's needed for an individual based on their scope of practice and even individual performance. In essence, from one library of bite-sized skills, you can have a targeted family medicine curriculum, targeted curriculum for surgeons, and other specialties. Again, respecting their time because it is all relevant, it is very effective at maintaining their attention during learning and producing change. It also becomes much more cost-effective to develop, producing significant ROI. Here's an example of one of our clients using e-learning to address cost savings and quality improvement opportunities discovered using the advisory board Crimson tool and delivered to learners in a targeted way via our training platform, which is accessible from any device. So remember, innovate in training using targeted, bite-sized training, which allows you to train more in less time and is very cost effective. Now go out there and innovate. Thank you.